Hello everybody, my name is Oliver. I'm a trans guy who is born and raised and currently living in Missouri. And so this video is going to be an update of, since 6 days ago, the Attorney General issued an emergency rule that is effectively going to remove access to care to a great number of trans people here in Missouri, effective next Thursday on April 27th. So obviously a lot of people are really scared, and this is very serious, and unfortunately we haven't had a lot of news coverage of it yet, and so I'm using my microscopic platform here to try to get information out to as many people as possible. So this video is going to be informing people who aren't aware what is happening in Missouri. I actually went over, read the emergency rule that was proposed by the Attorney General in a previous video, which you'll be able to find easily on my channel. And this is also going to be a video where I'm talking resources. Like, if you're a trans person and you're trying to maintain access to care, what steps you can take to stay safe and healthy. So if you live in Missouri, or if you know trans people who live in Missouri, or if you're aware of an LGBT organization that might benefit from having access to this information, sharing that to them would be a good idea. And if you have any questions that I failed to address in this video, if there's anything that I can do to help clarify or give more information to help keep more trans people here safe and healthy, leave that in a comment here, or you can try to contact me on Reddit or Twitter or something. Reddit's probably going to be one of the better ways to contact me. The first thing that I want to emphasize and make clear to everyone is that it is not safe here. It should not be controversial to call this an act of genocide against people like me. And that's not something that I'm going to go out of my way to argue and defend. I think it should be rather intuitive and understandable that I need testosterone as much as a cis man needs testosterone. Taking that away from me, it puts my health in jeopardy. It puts my life at risk. I also want to make it very clear that this emergency rule that has been put in place by the Attorney General does not affect just children. He advertises it that way. The Attorney General, Andrew Bailey, he virtue signals on Twitter, and he's like, this is about protecting kids. It's not about kids. This is going to take away care from adults. I'm going to start off by showing you guys a letter that a trans person in Missouri received from their doctor one day after this emergency rule was announced. As of April 27th, I will not be able to fill prescriptions for gender-affirming hormone therapy. I do not currently have the processes in place to defend my license to practice gender-affirming care should the state investigate me under the new Attorney General emergency rule. I will be trying to resolve this as quickly as possible, but I do not know how long that will take. In the meantime, I recommend requesting a 90-day supply of your medications. I also recommend scheduling an appointment scheduled with me every 3 to 6 months so we can work on building the documentation that is required for the Attorney General emergency rule. If this rule is overturned, I will reinstate your plan of care immediately. We're going to be talking about people who I have reached out to and how they are interpreting this rule that has been issued. And so when I say that it's not safe here, the Attorney General, if he's able to put a rule like this into place with no oversight, no checks or balances, and medical systems have no choice but to attempt to comply or lose their licenses or get in serious legal trouble, we are not in a safe position. We are not protected. Anything could happen to us. If the Attorney General decided that he wanted to put trans people involuntarily in mental hospitals tomorrow, it seems like he could probably get away with that and no one could help us. That's the position that we are in right now. And I don't want to get everybody scared. I don't want everybody to panic, because, it's not really actionable to panic right now. And so we're going to be talking about actionable stuff here, and trying to focus on that, try to stay grounded in what actions we can take to stay safe and healthy and okay. But an action that I would like you to take, if you can, and I know this is not realistic for a whole lot of people, is I would like to see more people working on getting out of here if you can. I don't have very much money. My girlfriend and I are barely scraping by. I'm disabled. We're in like a precarious situation, as a lot of people are financially, even if they're not trans. If you can find a way to leave Missouri, if you can start putting plans into place to do that, I would heavily encourage you to do that. My girlfriend and I are going to be moving to either Illinois or Minnesota in the coming months as soon as we are able to make that happen. And I'm going to be linking a map in the description here, a resource for deciding, like if you're going to be getting out of the state, where you ought to go, where is going to be safe. And so here's a map. I think this is relatively current. And so closest places, like I mentioned, Illinois or Minnesota for me and my girlfriend. I don't want to be a political refugee, but I guess, that's not really up for me to decide. On Thursday, when this rule was issued, one of the first things that I did is that I emailed my hospital, my care provider's chief compliance officer. And that is a title that you might want to keep in mind if you are a trans person in Missouri or a parent of a trans kid or something. If a chief compliance officer, what they essentially do, as you might be able to tell from the name, is they help make sure, their job is to make sure that their hospital system, their providers are in compliance, that they have policies at the hospital that is going to make it so that they're not breaking any laws, that they're up to date and they're doing everything they're supposed to be doing so that none of their doctors get in legal trouble. Their job is to keep the hospital out of legal trouble, basically. And so I actually emailed the chief compliance officer of my hospital, and I asked him, I'm a trans man, I'm a patient of your hospital system, and I need to know if I'm going to be able to maintain access to my care. So here's what he said. Thanks for reaching out. And he talks about a specific clause that is in the emergency rule. It says, continuing prescription or provision of a specific intervention that has already begun, so long as the person or health organization promptly seeks to initiate the treatments and assessments called for by these subparagraphs. And so what he explains here is that this clause, a lot of care providers in Missouri are interpreting this clause to mean that a lot of patients are essentially grandfathered in, meaning that if you have already been receiving a certain kind of care, you should be able to keep access to that care, keep getting prescribed your HRT, as long as you meet the other requirements that are listed below. And so something that I mentioned in my previous video is that I have some mental health diagnoses. A lot of people do. A great number of people have been diagnosed with depression or anxiety, and there is a clause, which I will show you. So this document that I've pulled up here is in the description. It is the actual emergency rule that the Attorney General has issued. And so that is something that you can access very easily. And I'm going to go ahead and read this part that is very concerning to a great number of people, which is, fails to ensure that any psychiatric symptoms from existing mental health comorbidities of the patient have been treated and resolved. What this basically means, and again, every care provider is going to be interpreting this differently and handling this differently, and I have faith that a great number of doctors in Missouri are going to work with their patients to use language that is appropriate to keep them safe and in compliance, safe from legal repercussions, but also keep their patients safe from being forcibly detransitioned from the state. I know that a great number of doctors do care, and they're going to try and work with you. But what this clause means is that if you have a mental health diagnosis, if you have depression, if you have anxiety, which a whole lot of people do have, then there's a possibility that your doctor might not legally be able to continue to prescribe HRT to you, which is fucked up and terrifying. And again, all medical providers right now are scrambling to figure out what they need to do to stay in compliance. I have reached out to my doctor, and I would encourage you to do the same as soon as you can. I know that you're probably feeling very overwhelmed. If you can ask for help, please ask for help. This is really important, and it's something you should not put off. So, because of this clause here, I do not know if I'm going to be able to maintain access to my testosterone. And that is obviously very scary and very distressing. Every time I say it out loud, I'm like, fuck. Here's something that I want to recommend to you in case your medical provider says that they cannot provide HRT to you because you have mental health comorbidity. So there is a website called the GALAP.org. It's GALAP. And so what this website is, it has a directory of allies to trans people who are mental health professionals who they sign a pledge. In order to get on this directory, they sign a pledge that says that they will complete a free session and provide a letter at least like every month based on demand for patients. Basically what this is this is going to be a list of mental health professionals who are committed, like dedicated allies to their trans clients. And here's what the pledge signers need to agree to here if you want to read that. And let's say directory. And so the reason why I want to recommend these people, it's not that you need a letter, but you do need documentation saying that you are mentally well enough, that your comorbidities have been resolved. And I think that the providers on this list, if anybody is going to be reliable to provide something like this, it's going to be the people on this list. So we go to Missouri, and unfortunately in Missouri we only have 6 providers, and here is the list. I think if you click on their name, it will give you contact information. Finding care providers who care about trans patients and who are committed to assisting their trans patients. That's going to be largely a word of mouth thing. Like, there are websites like this, there are resources like this online, but a big part of what is going to get you the access to the care that you need is communicating with other local LGBT people and allies who know who you can go to. So that is why I say again that you cannot do this alone, and you need to reach out to your community. And of course, there are a whole lot of other clauses down here that could exempt a lot of people from accessing care for incredibly bullshit reasons. And it's just going to be a matter of contacting your doctor as soon as you can and figuring out if you're still going to be able to maintain access. And one of the things that I want to encourage everybody to do is to refill any prescriptions that you have immediately. Now, like, you should have done this on Thursday whenever you first heard about the rule, or whenever you did. You need to do that now, because like I said, this rule is going to be in place. It is in effect as of next Thursday, April 27th. If you can request a 90-day supply, that would be ideal. And something that I'm probably going to have to do if I find out that I'm going to not have access to my testosterone anymore, I may have to reduce my dose when I inject at home, so that I can make it last longer. That is going to have health consequences for me, and I don't want to do that, but that is something that I might have to do. And so at your own discretion, I just want you to think about whether you might be able to do something like that. Something else that I want you to do is to remember that you are not alone. And okay, maybe you're alone right now because like you haven't reached out to other trans people, locally LGBT people and allies people that can help you. That is something that you need to do. This is not something that you can tackle alone. If you have not already, there are people who care about you who have not even met you yet. You don't know each other yet, and they will help you when you find them. That's what community is for. I need you to access your local LGBT community, even if it's only online, even if you can't get there in person. I need you to reach out to them and make contact with them. That is a place where you can ask questions. That is a place where you will be able to access more resources. Because of YouTube terms of service, I can't give you every resource that I have. I can give you some, but I do have to be a little bit careful here. And so that is what you need to access your community for. The AG's new rule effectively makes it illegal for people like us to be safe and healthy and alive. And that is his goal, by the way. That is why he passed this. He wants us dead. He wants us gone. And so if you've ever seen memes that say, be gay, do crime, like it sounds like a joke. It sounds so flippant and so fun and maybe not real, but it's entirely real. Be gay, do crime is when I'm talking about access and not being able to tell you some things because of YouTube's terms of service, that I'm talking about be gay, do crime. So there are some things that I can give you a little bit of an idea of, like, for example, I can refer you to the subreddit called Trans DIY. So it's Reddit r/Trans DIY. I'll put that in the description. And that's a place that you can visit to meet some people who know where to get some things. You may or may not be aware of a website called inhousepharmacy.vu. And there's a website called similarweb.com. So you can say, oh, I found a website where I can order prescriptions or order medication without a prescription. And you go on similarweb.com, you put in the website, and it will give you a list of similar websites. So this is a website where you may be able to purchase medications without a prescription. Testosterone is not going to be on these websites. That is something that I want to make pretty clear. But anti-androgens and estrogen will very, very frequently be available on websites like these. So I just want you to be aware that they exist. Something a lot of people might not be aware of, so I want to make sure that people are, is that if your medication is injectable, a lot of the time you do not have to necessarily have a prescription for your needles. I would go ahead and take note of like what size of syringe, what kind of needles that you need if your medication is injectable. And I have ordered the needles that we have at my house from goddamn Amazon, and everything has been fine with those. I know it sounds like a little bit sketchy, I guess, like there's a lot of stuff that I don't like buying from Amazon that I might not trust. I'd rather get them from a pharmacy, but if I have to get them from Amazon, then I get them from Amazon. If you search around, there are ways of acquiring your medications, and I don't want to downplay the effect that this is going to have on trans feminine people, because obviously, even if you have to order your medications, like, I'm not trying to compare and downplay and say that like somebody has it worse. That's not the purpose of this, but I want you guys to be aware of the fact that testosterone is a Schedule III controlled substance in the United States, which means that if you are caught acquiring or possessing it or giving it to somebody else, you could get in very serious legal trouble. Even though it's just medication that you need to stay safe and healthy, you could potentially end up in prison for getting medication that you need. Luckily for trans feminine people, estrogen and anti-androgens are considered more like a gray market item. You're not going to go to prison if you find a place that you can order that and it comes through the mail. One of probably the worst thing that is typically going to happen to you if you ordered estrogen and anti-androgens in the mail is that there's a possibility that a customs office could figure out that is what's in the package, and if they do, they might throw it in the trash. And so for people who need testosterone, there are places where you can order testosterone, and I don't think I'm going to be allowed to tell you where those places are in this video. But again, you can reach out to me privately, and this is really hard because I just feel like I just have to tell you bad news, which is it's going to be really hard to acquire medication that you need to stay alive and healthy, and I'm really sorry to tell you that. Some good news, this is going to be legal access. I started by telling you like the harder route, but here's something a little bit easier, more realistic for some people. Depends, like if you have a car especially, like, you're going to need some kind of transportation for this option. And yeah, I know a lot of us are really poor, so trying to make things as accessible as possible. But I contacted Planned Parenthood of Illinois. I showed you that map earlier. Illinois is a bordering state that has really good protections for trans people. I contacted Planned Parenthood of Illinois, and they informed me that they can treat trans Missourians. If your address is in Missouri, you can visit Illinois. You can make an appointment at Planned Parenthood and get a prescription for your hormone replacement therapy there. And something that I want to mention is that Planned Parenthood, if you do not have health insurance, they often do like a sliding pay scale. I have had several appointments at Planned Parenthood that were like $0 or close to $0. And, you know, like, I can't guarantee what your appointment is going to cost you, obviously, but I've had very good luck when it comes to cost at Planned Parenthood in the past. They need you to be across state lines, like if you have a telehealth appointment. Now, I don't know if you could potentially set up a telehealth appointment and just say that you're across state lines and that you're in Illinois. I don't know if that is something that you could potentially get away with, or if that is something that could get the doctor in trouble. And that's something that I want you guys to be mindful of too, is like, you should probably try not to get anybody in trouble who is helping you. Actually, that'd be really great if you could avoid doing that. But if you can contact Planned Parenthood of Illinois, what they told me is that you will have to get labs done. If you're trans, you probably already know this. You have to get blood work done to check and make sure that the dosage that you have been given, your HRT, is appropriate for your body. And so, like, every few months, you go and get your blood drawn, and they measure that, and they make sure that your dose is appropriate. And so, trouble with that is that there might be labs in Missouri who don't feel comfortable doing that. Like I said, every medical provider is going to be interpreting these rules differently. And you might have to make a whole lot of phone calls to find places that are going to feel comfortable treating you. That's just the reality of what's happening right now. And the same thing goes for pharmacies. Some pharmacies might feel comfortable giving you your medication after April 27th, and some of them might not be able to do that. And so if you end up going to like Planned Parenthood in Illinois, if you make a little road trip over there, or potentially a really big road trip that you have to do every couple of months, you might want to set aside some extra time so that you can get your labs done in Illinois as well, and find a pharmacy in Illinois. If you're wondering, if I have testosterone that is prescribed to me and I drive to Missouri, am I going to get in legal trouble? Like if I got pulled over, I would say that you would be in compliance. From what I understand, I think it is okay. I think it is legal for you to have the testosterone, because the rule that the Attorney General issued, it makes it illegal for doctors to do things, not for patients to do things. If you have a legal prescription of testosterone and you drive into another state, from what I understand, that should be okay. However, I did want to make you aware, if it's something that you do not know already, that just because something is legal doesn't mean you're going to be safe from transphobia. So, for example, I was unable to find the original story that I had seen in the past, but I have been made aware that there has been at least one situation where a transmasculine person who had a legal prescription for testosterone, and they were indigenous, they were brutalized by the police because they had this testosterone, and I guess the police officer, I don't know, I guess he was in a bad mood and wanted to harm a minority and knew that he would get away with it and it wouldn't be very big news. Evidenced by the fact that I can't find the story again. Hell, even this with the goddamn Attorney General, it's not been big news. It hasn't been. So anyways, I just wanted to make it clear that even though it's legal, even though it's something that you should be able to do, you may not necessarily be safe doing it, especially if you don't look like me. I'm white, I am cis-passing, and I'm transmasculine. I have my documents changed over. My license license has my legal name on it. It says male on the sex, and that's going to do a little bit to keep me safer than other people. So I didn't want you guys to think that things are going to be easy just because you have a prescription and just because it's supposed to be legal for you to move around with your medicine. The stuff that I tell you guys here, it's not because I want you to be scared. It's because I want you to be safe. I want you to keep in mind anything that could go wrong, and I want you to plan ahead, and I want you to do your best to stay safe. I've had some people ask me about like surgery disruptions, like, hey, if I had plans to get a like top surgery or a hysterectomy or something like that in like technically a trans affirming or gender affirming surgery in Missouri, am I still going to be able to get that surgery? And my answer to that is, again, every doctor is going to be interpreting these rules differently. Every doctor is going to have a different level of comfort and security and like legal resources for protecting themselves if they did get in some kind of trouble. Smaller private practice places are probably going to be more intimidated than large hospital systems with a lot of money, a lot of resources, a lot of legal protection. So that is going to be up to your surgeon. You need to contact them. You need to ask them if they're aware of the rule, and ask them if you're still going to be able to get the care that you need. Something else that I want to mention to you guys is that if you have delayed getting your ID documents updated, it is time to do that. It's time to do it now, today, right now. You might not have another chance to do it. If you need to leave the state, it is going to be a little bit more difficult to update some of your documents potentially if you don't do it now. If you need to leave the country and you do not have an updated passport with your current legal name and gender on the passport, you need to go get that done right now. That is what I spent Friday and Monday doing. I was going in and out of the courthouse, in and out of my social security office, in and out of wherever I needed to go to get my paperwork updated. And after this, my name and my gender, I'm going to have to go to court again. I already had to go to court once for my name change. I'm going to have to go again for my formal recognition of my gender identity, which is stupid. It's bullshit. I shouldn't have to do that. But I do. And it is stressful, and I don't want to do it. But my priority right now is keeping myself and my family safe. And so I encourage you to find a way to make this stuff happen. And like I said, if there's stuff on here that's like really overwhelming and you want more details, you want to know like, how does the name change process in Missouri work? How do I change my my birth certificate in Missouri? How do I change my license? I've already changed my license. I've already changed my legal name. I've updated almost everything. Everything should be done for me soon. And so if that is something that you would like me to make some videos about, that is something I can do. Thank you guys for watching. I'm really terribly sorry about the bad news. I wish that we were safe. I wish this wasn't happening. And that's all I can really say and do is I can give you resources. I can try to give you information, and after that, it's up to you. Don't try to do it by yourself. There are people who can help you. People care about you. You just haven't met them yet. If you think nobody cares about you, you just haven't met those people who will help you yet. They're out there. I promise you they are. So do your best to take care of yourself, take care of other trans people if you can, and especially for cis allies right now, or people who aren't directly affected by this, especially. If you can find a way to offer help. If you can drive people to the courthouse, if you can drive people to Illinois if they need to go, if you can just find ways to show up for people, make phone calls for somebody if they're overwhelmed. A lot of trans people are going to be really overwhelmed right now, and we do need help. So if you can extend a little bit of assistance, please do.